Hello everybody. So topic for today will be Bleb and Bulla. Before starting it, we'll read what is the difference between Bleb, Bulla, giant Bulla, lung cyst, cavity and pneumatocyst. So suppose if this is our lung and here an alveoli near to the surface of the lung gets ruptured somehow, it will create a Bleb. Okay, so this is Bleb. What is Bleb? Bleb is a small air-filled lesion of 1 to 2 centimeter in diameter. Okay, so it will be less than 2 centimeter in size. It is called as bleb. So rupture of the alveoli at the surface will cause a bleb. Bleb की खास बात क्या होती है? इसकी जो outer surface होती है, it is made up of visceral pleura. Okay, the outer surface of the bleb will be formed by visceral pleura. Outer surface visceral pleura. Okay. And it is most common at the apex of the lung, apex of upper lobe of the lung, or apical segment of the lower lobe. Okay, so it can be a cause of primary pneumothorax. Okay, so this is all about bleb. Now we have the second thing, which is Bullae. What is Bullae? Bullae is air-filled lesion which is more than 2 centimeter in diameter. What is Bullae? Bullae is more than 2 centimeter air-filled lesion. Okay. So it is not necessary that it is at the surface. It can be here, here or here. It can be deeper in the lung parenchyma. And one more thing, then these 2 or 3 bullae, they may enlarge, coalesce and enlarge to form a giant bulla. So there is a term called giant bulla. What is giant bulla? Giant bulla is a term when 2 or 3 bullas coalesce and combine to form a giant bulla and which covers more than 1/3 of the hemithorax. Okay. So these are some of the things which you need to differentiate, and there are few more things that you need to differentiate. Okay. Third thing is cavity. What is cavity? Cavity in a lung refers to air-filled space within a diseased area. Suppose this is a diseased area either due to neoplasm, granuloma. Granuloma can be due to tuberculosis or sarcoidosis, or it can be neoplastic lesion and it has caused a cavity in the lung. Okay, so this is cavity. Cavity की खास बात क्या होती है? इसकी जो outer wall thickness होती है, it is more than, it has a wall, cavity has a wall and it has a thickness more than 3 mm. So cavity will have a disease in lung. It will have a wall, thickness of wall more than or equal to 3 millimeters. Okay, so this is the most important thing that one needs to differentiate. And other thing is one more thing, which is pneumatocele. What is pneumatocele? Pneumatocele, it is an air-filled lesion. Suppose there is a lung and here occurs a trauma in the lung and it causes air to escape from the alveoli and this will cause a pneumatocele. Okay, infections with bacteria like staph, tuberculosis, pneumocystis carinii, this will cause air spaces in the lung which is called as pneumatocele. Another entity is lung cyst. What is lung cyst? Suppose this is lung and you have a cavity which is filled with either fluid And one important thing that this cavity is lined by epithelium. Okay, so this is, it can be congenital or acquired. Example, bronchogenic cyst. Okay, and there is fluid filled inside the cavity, so it is called as cystic cavity. So now we'll carry out with the classification of bulla. So there are two important classification of bulla, which is De Vries and Wolf classification, and second is Wiss and Roslin classification. So first we'll have Wiss and Roslin classification of bulla. What does this classification say? It says there are three stages: first, second, and third. Okay. So first stage is bulla with normal underlying lung parenchyma. Okay. Suppose this is lung. So all the lung except this bulla part is normal. All the lung is normal except this huge bulla. So this is stage 1. What is stage 2? Stage 2 is bulla with diffuse emphysema. Okay. So this lung will be a bit longer. It will have increased compliance. Okay. So there will be diffuse emphysema in the lungs and a bulla at the center. Okay, so the surrounding lung is not normal, surrounding lung is emphysematous. Bulla with emphysematous lung. Bulla with normal lung is stage 1, bulla with diffuse emphysema is stage 2, and third is the vanishing lung. Okay, vanishing lung, it means the entire lung is replaced by a huge bulla. Okay, so this is the third stage. And what is this classification called? It is called as Wiss and Roslin classification of bulla. Now we have the second classification, which is De Vries and Wolf classification. It has four stages: stage 1, 2, 3, and 4. What is stage 1? Stage 1 says there is a single large bulla. Okay, and the remaining lung is normal. Like the earlier classification, Wiss and Roslin classification, this is similar. Stage 1. Stage 1 says that there is a huge bulla and the surrounding lung is normal. What does stage 2 says? Stage 2 says that if we have this lung, there are multiple bullas. Okay, there are multiple bullas, but the underlying lung is normal. Multiple bulla, underlying lung is normal. Single bulla, underlying lung is normal. And what does stage 3 says? It says that there are multiple bullas. Okay, there are multiple bullas, but there is multiple bulla, but there is diffuse emphysematous lung. Okay, diffuse emphysematous lung. The underlying lung is not normal, it has diffuse emphysema. And what is the stage 4? Stage 4 tells that it has multiple bulla, but the remaining lung has some other lung diseases, but not emphysema. It could be either TB, granuloma, neoplastic, or other infections. Okay, so this is the De Vries and Wolf classification of. Now we'll read causes of lung bulla. Idiopathic, idiopathic due to unknown cause. Okay, and this can cause primary pneumothorax. It can occur in young females, especially, or prepubertal males. Okay. Second cause is use of substance abuse. Okay. Substance abuse in form of smoking, marijuana, cocaine, or IV drug abuse. Third cause is genetic. Genetic due to alpha 1 antitrypsin deficiency. It will be associated with emphysema then. Genetic predisposition in cases of Ehlers-Danlos syndrome, you already know. Fourth is inflammatory causes like sarcoidosis. Cystic lung diseases. Cystic lung diseases can also be associated with Bullae. Congenital like sequestration, lamb, and acquired in cases of traumatic or cystic fibrosis. Now we'll read what are the indications of surgery in Bullous lung disease. सबसे इम्पोर्टेंट टॉपिक है बुल्ला में सर्जरी कब करनी है. इंडिकेशन ऑफ सर्जरी इन बुलस लंग डिजीज. ओके, सो इंडिकेशन क्या होना चाहिए? अगर पेशेंट सिम्टम है और अगर सिम्टम नहीं है, ये सबसे इम्पोर्टेंट चीज है. इफ पेशेंट इज सिम्टोमेटिक और पेशेंट इज एसिम्टोमेटिक. एसिम्टोमेटिक पेशेंट में क्या हम सर्जरी करेंगे? अगर पेशेंट को कोई भी सिम्टम नहीं है तो क्या हम सर्जरी करेंगे? एक कंडीशन में कर सकते हैं, जबकि देयर इज अ सिंगल बुला which is large. Large means giant bulla. Okay, giant bulla means covering more than 1/3 of the hemithorax. जब ये कंडीशन है, एक जाइंट बुल्ला है विच इज कवरिंग मोर देन 1/3 ऑफ द हेमोथोरैक्स, दैट मीन्स ग्रेटर देन 30% अप्रोक्सीमेटली ऑफ द हेमोथोरैक्स, और हमको सीटी स्कैन या एक्सरे में पता चल रहा है कि देयर इज एविडेंस ऑफ एनलार्जमेंट, और यू कैन से प्रोग्रेसिव एनलार्जमेंट. हम 3 मंथ्स पे एक्सरे या सीटी स्कैन में फॉलो अप कर रहे हैं और हमको प्रोग्रेसिव एनलार्जमेंट साइज में मिल रहा है. लेकिन कंडीशन क्या है कि अंडरलाइंग लंग जो है इज नॉर्मल. ठीक है, तो एसिम्प्टोमेटिक कंडीशन में हम कब ऑपरेट करेंगे पेशेंट को? जब देयर इज अ जाइंट बुल्ला एंड द अंडरलाइंग लंग या फिर उसके सराउंडिंग लंग जब भी नॉर्मल है और कंप्रेस्ड है, तो हम बुल्ला की सर्जरी करेंगे ताकि पेशेंट को बेनिफिट हो सके और फ्यूचर में डिजीज का प्रोग्रेशन ना हो सके. So, to prevent the progression of disease in asymptomatic condition, you will operate in this case. Okay. Symptomatic. अगर पेशेंट में सिम्टम है, तो कितने सिम्टम है, क्या सिम्टम है, हम कब ऑपरेट करेंगे? तो फर्स्ट थिंग इज डिस्निया. If there is dyspnea due to bulla, ओके, रूल आउट डिस्निया ड्यू टू अदर कॉजेस और अदर डिजीज पार्ट. अगर साथ में कोई और डिजीज है और उसकी वजह से डिस्निया हो रहा है पेशेंट को, देन वी विल फर्स्ट ट्रीट दैट डिजीज एंड रूल आउट इफ द डिस्निया इज ड्यू टू दैट डिजीज और इट इज ड्यू टू बुल्ला. सो इफ बुल्ला इज कॉजिंग डिस्निया, देन यू विल ऑपरेट सच पेशेंट्स. एंड अंडर एक सिचुएशन है कि अंडरलाइन लंग शुड बी नॉर्मल और नॉन एम्फेसेमेटस. ओके, सेकेंड है सिम्टोमेटिक में, एक तो डिस्निया हो गया. सेकेंड सिचुएशन क्या होगी कि अगर बुल्ला का पहले कोई कॉम्प्लिकेशन हो चुका है. ठीक है, कॉम्प्लिकेशंस लाइक न्यूमोथोरैक्स, रिकरेंट न्यूमोथोरैक्स, इफ पेशेंट इज फ्रीक्वेंटली ट्रेवलिंग बाय एयर, ओके, और देयर इज persistent small pneumothorax, then also will operate such kind of patient. So now we'll see what is the pathophysiology of bulla. Pathophysiology of bulla. Okay. So suppose this is a lung. Okay. And there is a bulla inside. So how this, as you all know, this bulla is formed due to destruction of the alveolar air spaces. Alveolar walls are destroyed and you get a huge air space. Okay, so these walls between the alveoli they break down and you get a huge air space which is known as bulla. सो जभी भी ये वॉल्स ब्रेक डाउन करते हैं तो सराउंडिंग जो कैपिलरीज होती हैं दे ऑल्सो गेट डिस्ट्रॉयड और ये जो बुल्ला है ड्यू टू इट्स लार्ज वॉल्यूम इट कैन कंप्रेस द नॉर्मल लंग तो पहला जो बुल्ला का इफेक्ट है वो होता है कंप्रेशन ऑफ एडजेसेंट लंग पेरेन्काइमा सेकेंड थिंग इज यहाँ पे थोड़ा बहुत वेंटिलेशन तो हो सकता है तो जब ये थोड़ा वेंटिलेशन होता है तो इसमें क्या होता है हाइपोक्सिया और अगर हाइपोक्सिया होगा तो यहाँ की जो ब्लड वेसल्स है इनका वेजो कॉन्स्ट्रिक्शन होगा सो क्या होता है कि बुल्ला चूंकि ये पुअरली वेंटिलेटेड है एंड ड्यू टू पुअर वेंटिलेशन तो बॉडी क्या करती है इट डायरेक्ट्स ब्लड फ्लो अवे फ्रॉम दीज एरियाज फॉर बेटर वेंटिलेशन ऑफ द लंग्स एंड देर इज वेस्कुलर डिस्प्लेसमेंट ऑल्सो जो भी परफ्यूजन स्टडीज है उसमें देखा गया है कि पल्मोनरी वेसल्स जो है ये ऑफन एब्सेंट होती हैं बुल्ला में या फिर दे आर डायरेक्टेड टू द अदर एरियाज जहां पे बेटर ऑक्सीजन सप्लाई है ये दूसरा जो है ये है वेस्कुलर जो है वेस्कुलरिटी पुअर होती है बुल्ला में सेकेंड थर्ड थिंग इज देर इज वीक्यू मिसमैच they are ventilated but not perfused. So bulla they act as a space occupying lesion within the lung parenchyma and they also contribute to respiratory compromise. जो उतना हमारा एरिया है वो वेस्ट हो जाता है ओके लंग बुल्ला इज अ कॉज ऑफ carcinoma lung okay in young patient if there is emphysematous lung with bulla emphysematous lung with bulla there is 6.1% approximately risk of developing cancer. So, to exclude malignancy, you should follow Bullous patient every 6 months with low dose CT scan. Okay. So, how you will evaluate a Bullous patient? Evaluation of patient with Bulla. First of all, जैसे कि सारे diseases में करते हैं, we'll have a history and physical examination. Then we will stage the disease and plan investigation and treatment accordingly. Okay. So what are the tests that you are going to do? We will be doing routine blood workup, sputum examination, gram stain, AFP, chest X-ray, CCT, pulmonary function testing, DLCO studies. At least this number of tests are mandatory for evaluating a patient of minimum इतने टेस्ट हमको करने हैं इवेल्युएशन के लिए कि बुल्ला की सर्जरी हमें करनी है या नहीं तो सिंगल जो एक इम्पोर्टेंट फैक्टर है वो होता है वॉल्यूम ऑफ बुल्ला ओके सो रेडियोग्राफिकली हमने देखा कि वॉल्यूम ऑफ बुल्ला कितना है एंड सेकेंड थिंग जो हमको देखना है वो है फंक्शनल फोर्स एक्सपायरेटरी वॉल्यूम इन फर्स्ट FeV1 वैल्यू क्या है FeV1 अगर बुलेक्टमी के बाद इंप्रूव करेगा देन विल प्रोसीड फॉर द हाउ डू वी प्रोसीड फॉर बुल्ला सर्जरी सो proceeding for surgery how do we proceed first thing is we do pre-op preparation pre-op preparation में क्या important है pulmonary rehabilitation pulmonary rehabilitation में क्या होता है we'll do deep breathing exercises ask patient to do deep breathing exercises incentive spirometry and chest physiotherapy we can also give trial of steroids or bronchodilators or we can go for bronchoscopic toileting if there is excessive production of sputum second thing that you need to do is for preoperative anesthetic considerations. Okay, so These surgeries we should do in one lung ventilation with the use of double lumen tube. And if there is risk of developing pneumothorax in the contralateral lung, and if there is a disease in contralateral lung, then you can do a prior ICD in the opposite lung. Preoperatively, proper analgesic support and bronchoscopic toileting, if it is needed, then should be done. And then we'll go for surgery. The final surgery, what is the surgery? Surgery is bullectomy or non-anatomic wedge resection of the lung, which can be done via VATS or open. And what are the other options of alternative to surgery? It can be ablation of bulla or plication of bulla, or you can put endobronchial balloon. What? Sorry, endobronchial valve. Okay.